Hey guys, this is Paul Lynch. I'm an anesthesiologist and pain management doctor from Scottsdale, Arizona. Some of you have been following me since I spent some time in New York City at the beginning of this COVID crisis. I've been fairly busy with work, so I've been doing these kind of weekly, but I missed my video over the weekend. I thought about not doing one this week, but what I thought I'd do is just do a very quick video talking about testing. Everyone's talking about testing right now. What kind of tests we're using, who's getting the data, what the states are saying, what the CDC is saying, how the White House is interacting. It's actually become kind of controversial. So I just kind of want to jump in, and I'm not going to go through everything today. I'm going to make this kind of a quick video. You're not going to leave this video the world's expert on tests, but what I want to do is just give you a few things to be looking for when you're interpreting data, because I think it'll help you kind of understand what's going on with testing. So I'm actually going to use the Arizona website today because I live in Arizona and I know the data pretty well as an example. And I'll put links to the Arizona data below. But whatever state you're in, it's really the same concept. So number one, I want to give you three numbers, 20%, 10%, and 5%. The World Health Organization and the CDC has said that our goal is to have the percent of positive PCR test at less than 5%. And I emphasize PCR test for a reason. A PCR test is a test that looks for viral antigen in your nose or your mouth. And so the PCR test is the standard of care that you should be testing to find out if you have a virus. The PCR test is going to look for current infection. Now, ideally, we want our results on the PCR test to come back at less than 5% of the time that it's positive. That means we're widely testing, that anyone that's trying to get a test can get it. The next number is 10%. So 10% is the first cutoff according to the CDC where we should start doing some sort of shutdown. And then 20%, at 20%, we should have complete shutdown in society with restaurants and salons and gyms and gatherings. All that should be shut down if we're above 20%. So I just want you to remember those numbers, 5%, 10%, 20. If you're above 20, you should take strong action in your community. And if you're less than 5, then you're doing a good job. You've either controlled the virus or at least you're testing broadly enough that everyone who has it can be identified and then tracked. Additionally, you want to be able to return results quickly. So within, honestly, 24 to 48 hours would be ideal from the time that you do a PCR test that you would find out if someone has it. The reason for that is you want to find out while the person has an active infection that they have one, so that then you can do contact tracing. What's become kind of controversial in the media, depending on if you're watching left-leaning media or right-leaning media, or God forbid, social media is where you're getting all your info, then there's controversy on all sides of this where people are saying governments are testing one way or the other. And I'm not going to get into the controversy at all, as usual for me. I'm not a Republican or a Democrat. I'm a doctor. I just want to help you understand the test so you can interpret it for yourself. So number one, the PCR test is the standard of care that we should be testing. It is not recommended to mix the data from serology test with PCR tests. And there's a lot of reasons for that. But one really important reason is that the serology tests typically have lower positive rates. The serology test is not testing for active virus in your body. The serology test is actually testing for antibodies. And so if you have an active infection with COVID and you go to your doctor or you go to a clinic and you get a serology test, it's going to say negative a great portion of the time. The reason is it takes 1 to 2 weeks for the IgM antibodies to show up, and that shows acute antibodies, and it takes a complete 2 weeks for the IgG antibodies to show up. So if you get sick and go get an antibody test, it's often going to say negative. It's more important to get a PCR test. So one of the main reasons you don't want to mix them together is because it's going to show a lot of negative tests. And so let me use Arizona data as an example, and I want to kind of show you the website. So I'm going to put a link below, but I'm looking at today's number. It shows 1,559 new cases today. Now that number's pretty low, but this is a Monday, so we don't really report very well on Mondays. We'll need to check that tomorrow and see if it continues to be that low. But I'm less interested in today's video in the amount of cases, and I'm going to focus more on how to interpret the data. Now it says on here that the total percent positive in Arizona is 12.4%. That's a little bit misleading because that's all tests that have been done all the way back to April through today. If you combine them all together over about 5 months, 12% have been positive. That's not like super helpful. What we really want to know is what was the positive rate today. And so if you look, if you click on summary and then scroll down, that's the page I'm on right now. If you look below, it says that if you look just at PCR test, that they're 14.5% have been positive back to the beginning. So I said it wrong before. The box above that says 12.4%, that's all tests, serology, antibody test, or antigen PCR test, all the way back to inception is 12.4%. But I'd say that's 2 steps removed from what you want. What you really want is PCR tests done today, what percent are positive? That's the number that we should be tracking to decide what to do with society. And this is actually lacking on the Arizona website. This is not meant to criticize Arizona, but just for anyone who's watching this, when you're looking at your data, you want today's numbers, PCR tests. That's how you track how society's doing and how much active cases you have in your area. So for us, we show 12.4% positive of all tests back to inception. And then they do break it out and say, all PCR tests back to inception are 14.5% positive, but it doesn't go into just to today what percent of PCR tests are positive. I've been doing the calculation myself, and it's ranged anywhere from 20 to 34% over the last week or so. And I was gonna make a video on this several days, and I never got around to it, but I've been doing the calculation. I did the calculation on Saturday, and I had to estimate a little bit, but I estimated that 34% of PCR tests came back positive on Saturday. That's a really bad number. And so I know there's some good data coming out in Arizona, and I'm still hopeful, but let's watch the positive percent rate of PCR tests daily as we go forward. If you look still on this homepage, it shows total serology tests, and it says that the serology tests, only 4.4% have been positive back to inception. If you think about it, that kind of makes sense. One, people who are getting this test, sometimes they got sick earlier and they just kind of want to know if they had COVID. Those are likely to come back negative. Additionally, people who actively have COVID will go get a test and they'll come back negative because the antibodies haven't been created yet. And so there's a lot of reasons that the serology tests come back positive. So keep in mind, back to inception, PCR tests have been 14.5% positive in Arizona, and serology tests have been 4.4%. So said differently, the PCR test is about 3 times higher. And so if you combine those two numbers, it's gonna look better. And so if a number being reported to you is PCR plus serology, be very careful to accept that as a number that should be used for things like school reopenings or mass gatherings. I'm gonna dig just a touch deeper. This is going longer than I expected, but I'm gonna click on the tab that says laboratory testing, and I'm gonna put a link to this picture below as well. But if you click on it, you can kind of track the data week by week. And the Arizona Republic actually wrote an article today where they stated that the positive tests had come down from 21% to 18% to 16%. But I just want to take a little bit of an issue with that and help you guys with the data. It's taking us a couple of weeks to report all the data. And the way I know that is if you go back to the week of June 28th, we had 109,000 PCR tests. And then the next week, even though we increased our testing, we only have 84,000 test results on the website for Arizona DHS. And then if you look at last week, we only have 35,000. So we've shown 3 weeks in a row. And then actually today is a 4th week, we've shown we went from 109,000 to 84,000 to 35,000 to 11 tests. So what that means is there's a delay in reporting. And so I'd be very careful to look at data that's a week or two out on reporting and make decisions based on it. But if you go back to about 3 weeks ago when we had complete data set, it was 21% of our tests in Arizona were positive on PCR. And so hopefully that's helpful for you guys. There's a lot more I could teach and a lot more I could go into, but I wanted to make this video a little bit shorter today. When you're interpreting test results going forward, make sure you're really asking the question, is this a PCR test or is this a serology test? And if you have any questions, feel free to reach out to me. I'll do my best to answer as I can. As always, guys, the things that you can do to stay safe, socially distance, wear a face mask. It's a little bit crazy how political this issue's become, but it's really clear from the data now that wearing masks saves lives. If 80 to 90% of us wear masks over the next 3 months, we could really knock this virus out. So socially distance, wear your face mask, screen, track, and test, and what was my last point? I forgot. Socially distance and wash your hands. That was an easy one, I'm sorry. Wash your hands, and wash your hands a lot. God bless you guys. Thanks for following along, and I appreciate all the nice comments and everything everyone's given me. God bless you. Bye-bye.